Hi, my name is Dr. Loria, and today we're going to talk about the filler. There's a lot of questions out there regarding what it is and what it isn't, and so forth. I had patented a filler several years ago, and it's a permanent filler, right? You put the filler in, it generates collagen, and that collagen is permanent and stays with you for decades, all right, generally a lifetime. The filler I use, one of the components, key component, active ingredient, is silicone oil. Now, silicone oil is, I call it the Rolls Royce of fillers when used correctly. Okay, for example, this filler, we'll say the silicone oil active ingredient component of it, has been used since the 1950s and continues to be used up until today by many cosmetic dermatologists. Now, generally, they use silicone oil, the pure oil, for facial injections. Okay, it's called a micro droplet technique. They'll drop in 100 little droplets into the cheek, 100 here, again into the dermis using a needle. And then what the body does when it sees a little droplet of oil, it will surround it with collagen. So not only does the oil give some volume, but the collagen gives most of the volume. Okay, it's called a foreign body reaction. Where your body reacts with this oil, generates collagen. That's all you have to really remember with that. So when I used to use it on the face, right, I actually treated women, many women, some men, in the facial areas to increase their cheek size and so forth. And what you do is make literally 100 to 200 little tiny injections. So let's say you got 200 little droplets, another 200 droplets of the oil. The bottom line is when the body sees that oil, it surrounds it with collagen, anchors it, and it stays there forever. Okay? But what's the bottom line is it's a tissue builder, right? It's a volumizer, so it's going to increase that cheek size. That's the objective. Okay? Same thing when you put it in the lips or anywhere else. Now, we took that concept, okay? I took that concept and said, okay, how do we use oil in the penile shaft, right? You can't do micro droplets into the skin of the shaft. You might have like bumpiness and so forth. So what I did was I put this silicone oil, which is of course, always medical grade. That's important to distinguish because we have silicone oils at a medical grade that can be injected in the body, and there are silicone oils that cannot be. So we use medical grade silicone oils. In fact, I go a step further to purify it. But bottom line is it's injectable grade, medical, sterile, pure silicone oil. And what we do with this is we have the oil in an emulsion, right? So we put it in a solution that makes thousands and thousands of little droplets. And now we inject it in the skin of the penile shaft, right? So what happens is you're literally getting the same droplets in a different form. So here we injected them individually. Here it's in a solution. So we inject the filler in the penile tissue. The body's still going to see all those droplets. And each droplet's going to be surrounded with collagen. Same reaction. It's just a different delivery mechanism, right? We're delivering it in a different way. So instead of one by one droplet, right, delivering a droplet one by one, we flood the area with thousands and millions of droplets, and your body will surround each one of those with collagen, and with the result of a nice collagen sheet development all over. Okay, it's a phenomenal reaction. So why would there be any negative to that? Very, very little. Like with any filler, you can get inflammation, right? With whether it's a silicone oil ingredient in there, like with my filler, right, my permanent filler. Of course, you can get some inflammation, some redness, some itchiness. Sometimes, on a rare occasion, you get a skin sore somewhere. Well, it heals fine. But this can occur with any filler. Any hyaluronic acid temporary filler can do all the same things as this permanent filler. Okay? They all behave the same because the skin reacts the same. It's going to inflame a little bit. It's going to get red. It might get itchy, etc. You can get temporary filler and get a skin sore, which heals fine as well. Okay? So if you're looking for a permanent filler, right, as opposed to temporary, I think it's a better choice because, I mean, economically, number one, you're going to save, right? So if you do 2 treatments with me with the permanent filler, right, and get an 1.5-inch, 2-inch gain in girth, and you're happy with that, well, you're pretty much done. With temporary filler, you got to go back sometimes every 6 months to a year, spend the same amount. The cost is incredible. I don't know how many patients can afford that. I think that's a lot. Okay, but the permanent filler is permanent. Will you need a little touch-up later? Perhaps. Because this is living tissue that we made, right? When you make all that collagen, it's living tissue. So living tissue can adjust sometimes. Sometimes it could remodel, right, which collagen normally does. So over time, let's say a few years, you notice maybe you have a little shallowness somewhere. You can always put a little filler there to correct that, okay? So is there some maintenance? Yes. It's not extensive, but it's fairly stable, okay? I have patients out now 10, 15 years, and it's been very stable, right? So at least when I started using this particular active ingredient, silicone oil, which again is the Rolls Royce of fillers, when used correctly. I will make a note and discuss a little bit about when it's not used correctly and what the problems are. But when it's used correctly, it is a phenomenal filler, bar none. There's nothing really second to it, period. Now, those who complain or may say things negative about silicone oil, you'll notice that they've never used it. They have known nothing about it, okay? They look at certain articles, medical articles, where there was some negative news about silicone oil. Now, I'll tell you about the negative news. Non-physicians, okay, non-physicians have been grabbing or buying silicone oil from somewhere and injecting it in, let's say, women's behinds, okay, in the buttocks area. Now, automatically that's wrong, okay? That's bad. But when they inject pure silicone into the behind or any part of the body, if you don't know the anatomy of the body, I don't care if you're injecting silicone oil or hyaluronic acid or whatever. If you don't know where you're injecting, obviously injecting a large vein or artery, you're going to cause problems. This is common sense stuff, okay? Now, physicians know the anatomy of the body, right? They know to use pure products, sterile products, and they know where they're injecting it. Now, if a layperson, non-physician, buy some oil from who knows where, it just says silicone on it, okay, and they inject it in somebody and hurt them, well, that now spilled over into the medical community. That bad news spilled over as though that's happening in the medical community, and it is not. Okay, again, silicone oil has been used since the 1950s. Many cosmetic dermatologists inject it in the face. I did as well. I just changed the formula so we could apply it to the penile shaft. Very, very safe, very effective, and very consistent. Okay, those are the results. Okay, I've done this over 10,000 plus times. I don't even count anymore. And we get consistent results. Okay, it's not that without any issues. Of course, we mentioned, could there be a little itchiness, redness? Yes, these things happen with any filler. And will you need a touch-up? Perhaps. Okay, if there's a little imbalance somewhere, like the base area, sometimes it's a little more narrow than the rest. And that's because the skin in the base of the penile shaft is thicker. Because the pubic skin continues on to the base of the penile shaft, which is thicker skin, then it thins down into the penile shaft proper skin, so to speak. So this area is thicker skin. It's harder to expand it. So sometimes the base will be a little more narrow. Not in everybody, okay? But these are the things we have to deal with, okay? If we're talking about issues with any filler, right, number one is, can we achieve the size that we want? And I have guys that like this, I mean, literally 10 inches in girth, which is craziness. I don't recommend that. I recommend 6.5 to 7.5. But the objective here is that bottom line is this, is safety and efficacy. Bottom line with the filler. Let's look at the negative news and keep it where it belongs with the lay people, non-physicians, using it illegally. That's where that news belongs, not in the medical community. Okay? Let's make sure that's clear. If there's any questions about that, you can certainly send me a message, info@loriamedical.com. There's a lot of information on my website, loriamedical.com as well. But this whole thing, this cloud over silicone oil, again, is a Rolls Royce of fillers when used correctly, really. Silicone is used in other parts of the body too, right? Because it's the most consistent type of material, and we know how it behaves and reacts in the body. I just want to re-emphasize that. Okay, when, for example, the oil we use for fillers, the gel we use for breast implants, the rubber we use for breast implants and other parts in the body that we want to use a device for. it becomes, we can make it into a plastic form where we could do a cheek implant, chin and cheek implant, or implants in other parts of the body. So it is used in millions and millions and millions of people over the years. It's been used. Why? Because it's a great material. It really is. Again, it has to be used correctly. So those who oppose it, I guarantee you they've never used it. Okay, that's the sad part about it. Okay, so if you, again, any information, any questions rather that you have, look at the website. There's a lot of information there, and you can certainly reach me directly. Okay, so hopefully we'll see you in our office, and you'll have a couple of girth enhancement treatments done. Of course, we do the glands as well and the scrotum. Don't forget that. Some guys have a tight scrotum, right, where the testicles rise up. The scrotal treatment with filler expands that. It also enlarges that. There's a lot of benefits to that too. But consider those treatments, right? The shaft, glands, scrotum. Especially the shaft is the most important, obviously. So economically, if you're focused in on, look, I have certain funds, you put it here in the shaft, okay? You want to get an 1.5 to 2-inch gain, and that has a powerful impact on vaginal stimulation. But again, it was great talking to you today, and hopefully we'll see you in our office very soon.